Hello everyone, I'm Pooja Datta, an RCI registered clinical psychologist and special educator. I have over a decade of experience in working with individuals in the spectrum. Through every phase of my professional career, I have catered to different individuals as well as children with autism and other neurodevelopmental condition at their different phases of life. In fact, I have grown up as a professional in the field of disability, working with children with diverse emotional and developmental conditions. Let's start with the first one. What is autism? So autism, it is at times a mystery. People, they are not able to understand what autism is. Autism, it is a neurodevelopmental disorder. When I say neurodevelopmental disorder, which means the condition, it doesn't happen suddenly. So an individual is maybe 10-year-old and suddenly he is having autism. He is suspected of having autism. No. By neurodevelopmental condition, we mean that the condition it develops when the fetus is inside the mother's womb, or it may develop in the very early formative years. Autism is one such neurodevelopmental condition that the symptoms are apparent by the formative years of life. By as early as 3 years, the symptoms are quite apparent, even at 2 years or maybe 13 months even. There are 3 core symptoms of autism. First is individuals with autism, they have difficulty in communication, both receptive and expressive communication. They face problem in social interaction, communication and social interaction. These two are again reciprocal. And third is they have problems in flexibility. They are quite inflexible. Flexibility can be very simply, flexibility, it is both psychological flexibility as well as behavioral flexibility. So individuals in the spectrum, you will see that they have problems in shifting from one idea to the other. They are very resistant to change. They get focused, they get fixated at one topic or idea or one activity. With behavioral flexibility, we mean the flexibility from switching from one behavior to another. Again, individuals in the spectrum, they have problems in switching from one task to another, leading to a lot of repetitive stereotypical behaviors like hand flapping, hand clapping, toe walking, even the stimming behavior. Now we come to the terminology that we use, autism spectrum disorder. When we say spectrum, we say that no two individuals who are having autism, they are same. Autism, it has such unique features that every individual who is having autism, they are different in their own way. Though quantitatively the symptoms may match, two individuals with autism, they may have difficulty in reciprocal interaction, but qualitatively their characteristic features may differ. Earlier, if this is just for your understanding, viewers, earlier there was no term as autism spectrum disorder. We had pervasive developmental disorder, under which there were 5 main conditions. One was Asperger's syndrome, second was Rett's disorder, third was infantile autism, fourth was childhood disintegrative disorder, and 5 was autism not otherwise specified. But now, like I said, this 5 overlapping conditions, it was difficult in terms of diagnosis as well as intervention. So for our ease, for better therapeutic and diagnostic purposes, it was clubbed and now it has come to one umbrella term, autism spectrum disorder. So if I say a straight line, one individual in the spectrum can be here, one individual can be here, one can be here, one can be there. All are having different degrees of autism, all are lying in different points on the spectrum. That is why nowadays we say autism spectrum disorder. We use interchangeably autism and autism spectrum disorder. There is no harm in using, but we should know what autism spectrum disorder it technically means. So, another very important question, what causes autism? For any neurodevelopmental condition, or rather for any disability per se, the general conditions It can be biological. It can be because of some biological factors, right? Some deficits in the brain structure and function. It can be because of some genetic loading. Maybe the individual has high genetic loading from the maternal or paternal side for, causing a neurodevelopmental condition or a psychiatric or any other physical condition. It can be environmental. Environmental, it means when the fetus is inside the mother's womb, maternal womb is the internal environment. When the fetus comes out as a baby, that becomes the external environment, right? So these are all the general factors. So if I say the environmental factors inside the maternal womb, so how was the maternal condition? For example, was there any maternal exposure to any harmful toxic substance like lead? Was the mother consuming alcohol or anything when the fetus was inside the mother's womb? So was the mother suffering from any kind of psychiatric condition, malnourishment? These are all the maternal internal conditions, right? Internal environment. When the child is coming out, maybe the child, there has been a difficult labor. The child has some prolonged exposure to some harmful substance. The baby has fallen from somewhere. The baby had malnourishment, right? The baby had some, difficult disease like measles or anything like that. So these are in general we can see. But when we say that what has caused autism to a particular individual, there is no concrete answer. That this particular condition has led to this. No one can say, no one can foresee. We can rather predict that this condition may have caused autism unless and until we have some concrete biological evidence. That too, it is controversial. So autism, it can be caused either by genetic factor, by biological factor, by any environmental factor, or a combination of these three factors in any permutation, in any combination. But we cannot concretely say that this particular factor has caused autism in an individual. With this, we move to the next question. What are the early signs of autism that parents or caregivers should watch for? This is very, very important. This is important for two purposes. First is, we as individuals, we as parents, we as relatives, as teachers, we play so many roles. We need to understand this. So when that happens in our family or personally to us, we are observing something, at least we can understand that we should not procrastinate, rather we should visit an expert. Second is for advocacy, sharing awareness amongst others. That see, I'm observing this in the child. I may be wrong, but maybe you should go for some expert supervision. With this, we move to the core red flags of autism. We know, even, if I tell it simplistically, every infant goes through some developmental phases, right? So, for example, at 3 months, there is some kind of social smiling. There is some meaningful eye contact, a relatedness to the caregiver where the child is sleeping. The environment is very restricted, but relatedness with the caregiver, relatedness to grandparents, relatedness to the father. So if there is some kind of, snapping sound, the baby will look, or the baby will try to look. The baby will try to engage in some reciprocal interaction. So you laugh at the baby will laugh at you. The baby will gaze at objects. That's why we give toys on front, isn't it? So, they hear the sound and they rather track the object. So, eye contact, tracking object, looking for the caregiver, a sense of belongingness, relatedness with the environment. By 6 months, we say it's, Onnoprashun in Bangla we say, or, the rice ceremony. The baby starts babbling, ba, 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 ba. Speech is developing. That speech by 9 to 10 months, it develops into some meaningful 1 or 2 phrases. And gradually it leads to 2 meaningful words, creating a phrase. Then it leads to meaningful sentence construction, isn't it? These are all the developmental parameters that typical children, they go through. When we see from a very early stage, 13 months, 10 months, that the social parameters are not reached, the child is not making eye contact by 3 months of age when it is supposed to. Maybe there may be a little delay, we can wait, but simultaneously, So reciprocal interaction. The child is not able to express its basic needs, tendency of staying into its own world without getting that relatedness or belongingness with the surrounding, not reaching out for objects, not making eye contact. These are all the early indicators which are apparent as early as 13 to 15 months of age. We should not sit, we should not procrastinate that, okay, things will be better. We are thinking too much. No, it's always better to go to an expert and seek their expert advice. So these are the early signs. As soon as you see the signs in your immediate family members or to someone else, please do reach out, please do advocate. The next question is, what are the common symptoms of autism across age? So this is a very related question that I have already catered. So different developmental phases, they have different symptoms. You know, when you visit to the pediatrician with your baby, so the pediatrician says, okay, the baby is 1 month old, so this has these parameters been reached. The second month, this has been parameters being reached, and then they give us adequate suggestions based on that. So during the early formative months, by 6 months, the child should have meaningful smile. The child can track objects. The child can maintain eye contact. The child, even through crying, can express basic needs. Babbling will happen by 6 months, followed by meaningful speech around 12 months, like 1 or 2 words, and by 2 years, there will be meaningful speech, lot of vocabularies. When the child is entering the playgroup, curiosity with the outside surroundings, trying to interact. The child may be shy, the child may be introverted, but at least trying, or that awareness is there. Can relate the answers to the questions, can give meaningful answers, can comprehend. Not willing to communicate, that is fine, but can communicate, can socialize. There will be no stiffness or repetitive behaviors. These are the early symptoms of autism that are apparent by 3 years of age. And when the child enters, into pre-primary 1, pre-primary 2, the symptoms are quite apparent. With this, we end today's conversation. I hope this discussion was quite meaningful and insightful to you. Thank you so much for watching this video.